So Carolyn is having some hip issues when this hip tends to give her some trouble. Some of it has to do with her feet. If you can see how she does this, she tenses her foot. I've been trying to get her to stop doing that for, I don't know, 10 years. She's better than she used to be. Her feet used to be like that. Now they're a little easier, but she still has a habit of tensing her foot, okay? So that tends to affect her knee and her hip. What I'm going to do is go directly to her hip and test some muscles and find out what muscles might be not turned on, like a light switch turned on when she does something. Do her muscles know what to do or not? Now, if you've been watching my videos, you know I do a lot with muscle testing, and sometimes it looks a little funny, but it's a way of finding out what is happening in the body. So if her body can handle a little more stress on an area, then her strong arm, go ahead and press here, see it's very strong, will stay up. If a part of her body cannot handle a little bit more stress, then the arm will go down. Let's see what happens with the hip that is not bothering her. Push back. See, her arm stays up, everything's fine, that looks okay. There are other ways I'm going to check it, and for this particular way, that hip is not the one that's calling out to us. This one, push, I put a little extra stress on it, and she cannot hold up a previously strong and locking muscle. So now I know I've got to figure out what's going on with this hip. So let's first check your quadriceps. Bend your leg and push your knee toward your nose. Now those are turned on, that's okay. When she goes up the stairs, her quadriceps know to work. Let's see about turn your foot in and push up this way. This muscle she cannot hold up. Now I'm testing muscles in a different way. I'm actually testing the integrity of the muscle. This is called the Tensor Fasciae Latae, or the iliotibial band is what a lot of runners know it as. There's a teeny little muscle, but very strong muscle up here that's called the Tensor Fasciae Latae. And the iliotibial band is the long tendon here that ends up attaching here. So her Tensor Fasciae Latae muscle is not turned on. It doesn't know what to do. So what I do is now find out if the neurological flow is getting there. So what I want to know is if I touch your lower back, because that's where the nerves come from, and I've got my hand right here on her lumbar spine, push. Okay, so that also cannot handle any extra stress. So what I'm going to do is I'm actually going to have you touch, I'm going to go on the other side, I'm going to have you touch this, and I'm going to use a different muscle. Take your hand off of there. Let's make sure you have a testable muscle here first. Push. Yes, you do. Touch where it hurts on your hip and push. That's great. That extra pressure on her hip causes her any strong muscle to go weak. Now I'm going to see, it's like a double negative in a sentence. Is this related to what I just found in her lower back? Does it make it different? Push. Yes. Okay. So when we touch this problem and this problem in her lumbar spine, her arm goes strong again. So what I'm going to do is I'm going to adjust her lower back. And I'm going to put my leg up here and I'm going to adjust this lower back. If anybody's ever been to a chiropractor, you may have been adjusted this way. There are many different ways to adjust. So I'm going to check and see if that's all her lower back needed. Now, touch your hip again and push. Now her hip is better. Now what we want to do is find out if that's all it needed to strengthen up that muscle. So bring this foot up, remember this one, and turn it in. And now take your hands off your body so your body knows what question we're asking it. And now you're going to push up and out this way. Push. And she still needs a little more with that. So
you can feel it right
You can
there.
feel it in there. Okay, so hold this leg up. Push straight up. Okay, that's another thing she doesn't need. But what she does need is to have this hip adjusted. This is going to look pretty hefty. I want you to bend this leg. I'm just easily dropping this back into place. That was it. Push up. Now, let's see if that is better. Let's try that one again. Turn it in and push up and out. Okay, It's a little better, but I'm not quite satisfied. So I'm going to actually do something to strengthen this muscle. And there's just so many different layers of things that need to be attended to. And so right now I'm going to do something to strengthen that muscle. This might be tender. All right. Bring this up, turn it in, push up and out. That feels better, doesn't it?
Yeah, a lot better.
That feels better. And I could tell, and she could tell. So then the rest of the treatment, I'm going to check her knees and her ankles and the rest of her spine as well. So hold this up, pull back. I'm seeing if her knees need any attention. That knee's okay, that knee's okay. This ankle's not okay. Interesting. So what we want to do is when I touch her ankle, see, push, she can't hold her arm up. So I'm going to go ahead and adjust that. Good. And let's see what happens with this. Push. Now she can hold it up. Now let's see if anything else has shown up. You've seen me do this on other videos also. And sometimes something doesn't show up until something else is adjusted. We call the chiropractic treatment an adjustment.
Like when you tighten screws.
Like you tighten screws. Kind of.
Sorry.
All right. This is a real adjustment that I'm doing on her today. And so this isn't just a demo. And so I'm going to do something called Neurocranial Integration. And this is just a stretch of the, it feels like a stretch of the neck.
My favorite thing.
It's her favorite thing, she says. Say that again.
It's my favorite thing.
And the reason it's her favorite thing is because it's very relaxing to the nervous system, and it actually stretches the whole back of the body and then the tissue around all the muscles and organs. All right, so breathe in and all the way out, and I'm just going to adjust this. Drop your shoulders. Ooh. That feels pretty good, doesn't it?
Mm-hmm.
All right, now I'm going to use the muscle testing again just to make sure, bend here, make sure that everything is in alignment, and I'm just checking, okay, there's a little more in her lower back that needs to happen. You'll put this here, straighten the bottom leg right out. I'm going to put my leg here and adjust right there.
Okay.
So let's move you just a wee bit here. Beautiful. All right, lie on your stomach. Let's make sure that's all done. Okay, bend this leg again and push. Excellent. Push. See, now I touch it and it's okay. She can hold her arm up. I mean her leg. All right, good. I think we're done.
Yay.
Yay. If you like what you've seen and you're interested in getting more information or having a chiropractor like me, you can give a call to our office and or comment below. And if it's not me, maybe I can connect you with somebody in your area.